This is another in our series of interviews with doctors and nurses who are working on the front lines of the COVID-19 pandemic. And we're going to be talking to Carolyn Howe-Riddell, who is a nurse in an Edmonton hospital who works on a COVID-19 unit. And she has got stories, well, you're going to hear them for yourselves. And she's a little upset about it. So I warn you in advance, she may get a little angry. And that's part of the response of many of the healthcare professionals I'm interviewing. So anyway, welcome to the interview, Carolyn.
Thank you.
Look, I really appreciate you doing this. So let's just start out. Tell us what you do and, how it's affecting you.
Okay, yeah. So my official title is clinical nurse educator. And what that means is I work basically in staff development with new and existing nurses. But over the last probably 6 weeks, 4 to 6 weeks, really what the focus of my whole team's work has been is training the staff, developing their skills in proper PPE use, trying to keep them safe on COVID units. And sadly, a big part of my job has now been opening COVID units. So we've just opened our third COVID unit on Friday, actually.
And it sounds like the hospital is, I don't want to say overwhelmed yet, but I mean, if the COVID units are expanding, that means other beds are being pushed out of the hospital, right?
Oh, sure. Yeah. These units, we have opened units where, for example, there was a unit that sat empty. So we've taken over that unit. So if you were going to be admitted for, let's say, I don't know, a heart attack, they would find a bed for you, but it would not be that easy because we are quickly filling up with COVID patients and our staff are getting sick as well. So, or they're quarantining, they are being spread over these additional units. And so not only are beds an issue, but staffing those beds is
right. And a lot of these people have been doing this for 10 months already, or 8, 9 months, and they're I'm being told they're exhausted. They're right at the edge of, they're at the end of the rope.
Yeah, they absolutely are getting very, very tired. But the busier that we're getting, it just, it's emotionally exhausting and physically exhausting for them.
So you were telling me that in these COVID units, you've got people who are mildly sick but need to be hospitalized, all the way up to folks who are, need to be transferred into an ICU and intubated, put on a ventilator. Yeah. So what's it like for you as a nurse having to treat folks and see them that sick, and what's it like?
It's morally distressing, right? It's really, really hard. It's exhausting work for a lot of the nurses that I'm working with. These are unfamiliar patients that they're dealing with. It's outside of their specialty area. So they're being pushed to do things that they've never done before. And that's difficult for them. And so when you talk about exhaustion, I think that it's physical, emotional, and then, their learning curve has been probably like this, because they've gone from taking care of, some of them were working on, units that had patients waiting long-term care. And now they're caring for patients that are almost ready to go to the ICU. So that's exhausting as well.
Right. And I'm being told by other healthcare, like doctors in ICU, they're sitting there holding somebody's hand while they die because the family can't be in with them. And they sit there for 2 hours while this person expires, and what a horrific experience that is for them.
Yeah.
Are you suffering from, experiencing those kinds of emotionally distressing events as well?
So myself personally, I have not, but many of the nurses on the unit have done that. And I think that they are trying somewhat to make exceptions if that was the case, and letting, a family member in, but sometimes it's not possible. And so we've had patients also that their family was, positive as well, so they weren't able to come in. So yeah, some nurses are experiencing that for sure.
Now, one of the things we're hearing, I mean, it's been about, I'm guessing now, but I think about 10 days that Alberta has had elevated infection rates. Like on just the other day, it was almost 1,900 in a day. I mean, it was the highest in Canada. And what I'm told is that those infection rates will eventually, X percentage of them will wind up in hospital, and X percentage in ICU, and X percentage on ventilators. So is that what you're being told? Is that what you're seeing? And is that what you're preparing for? And if so, what's it like?
That is what we're preparing for. It's surreal, to be honest. It's just, at the start of this pandemic, we were watching on TV what was going on in New York, what was going on in the States. And we were doing so well here, and it just didn't seem like that could ever happen. And now we're at the stage where it just feels like every day you go into work and you have this knot in your stomach because you don't know what you're going to come into. So as these numbers rise and rise, I honestly don't know where they're going to put these people. I mean, they've got plans in place for sure, but when you're working in it, you just think, oh my goodness, like 2 weeks from now, are we going to be nursing all these people in like the library? It's absolutely surreal.
Well, I mean, that's one of the criticisms of these field hospitals that the Alberta government has asked the Red Cross to set up is great. Yeah. You got a field hospital for 750, whatever the number is. And now where are you going to get the staff? You're already stretched thin on the facilities you have. Where are you going to get the staff for the field hospitals?
That's a very good question. That is a really, really good question, because I don't know. And I think that the staff to patient ratio is going to be so high that in itself is going to be really, really problematic.
One of the reasons why we're having this interview is because, like me, this makes you angry, and it makes a lot of your
yes.
colleagues angry and frustrated, yeah. and upset. Tell me what that feels like for you.
It's I'm having a hard time articulating it even. It's just, I'm angry, I'm frustrated. I hear comments from, even like people that I know, and I'm so tired of hearing, but what about the economy? What about jobs? I get that. I get that people are worried about their jobs, but we are at the tipping point in the hospital that I don't know, if they don't shut our economy down, for a couple of weeks and just really get this under control, I honestly worry about what's going to happen. And people just don't get it. They just do not get it. And even, amongst people I know, they're saying, but, Christmas, for example, people aren't willing to give up Christmas. And I get that that's tough, right? But they're still going to have their families over. They just don't get it. And that to me is infuriating.
Right. And you were telling me about a Zoom meeting you had recently with some girlfriends of yours, yeah, where that kind of conversation came up over and over again.
Mm-hmm. Yes. Because I think in large part, the general public just has no idea what's going on in the hospital, right? To be fair to the general public, if you're not working in a hospital, or you're not, living with somebody that works in the hospital and getting an inside view into what's going on, you just don't know. You don't know. And the message sort of that's being sent is, just be responsible. And so everyone's version of being responsible is different. You know, it's coming from the top that, you know, it's your personal responsibility. Well, that's a tough one, because we're not all, you know, functioning at the same level of personal responsibility.
Yeah, and it doesn't take a big percentage of the population to not be personally responsible to drive huge infection rates.
No, not at all. Not at all. And it's just, yeah, I've said it like, I don't know how many times to already. It's just infuriating. It just really angers me. And I think that some people, they watch it on the news, or they're reading these comments and they just don't believe it. They just, it couldn't be that bad.
Look, Carolyn, this is your opportunity. Look into the camera and tell the people of Alberta what you would like to tell them to get the message across of just how bad this is.
Sorry, my husband just got home. What I would like to say is that from a nurse's perspective, this is really, really serious. We are scared in the hospital. We're worried. We are working at our absolute capacity. We still continue to take patients, and we are working with less and less staff. And as people aren't responsible, what happens is when we get sick from somebody that wasn't responsible, now we're not there to take care of somebody. And that's happening all over the hospital. People are off, the nurses are sick, they're quarantining. We are working with less and less and less staff. Every day our units go short-staffed, sometimes 1, 2, 3 nurses short, and that's not safe for anybody. And so what I would like to say is, please stay home. If you don't have to go out, stay home. This is real and it's scary.
Well, that is, I don't know what else you can say, Carolyn, at this point in the game. And I mean, if nothing else, because I know there are people out there who say, well, you know, it's only old people or people with comorbidities, that they're really, you know, it's their own fault. They were fat or had diabetes or whatever. You know, pretty kind of a callous attitude.
I know,
but,
we hear it all the time. Yeah, that's another thing that really, really, really makes me angry is, well, you know, what were their comorbidities? Well, when you get to be a certain age, I mean, even my own cohort of friends, there's not very many of us that don't have one of those comorbidities that could put us at serious risk, right? And it's just, you read that and it's so callous and so cruel. Well, you know, what were their comorbidities? Well, really, because you have high blood pressure, that means that,
yeah, it's like somehow your life is valued less, and the more comorbidities you have, which increases, you know, your risk goes up, then your life has less and less value. That's kind of the implication of what they're saying.
Oh, yeah, and it's just cruel. And even if they're just referring to the older population, I mean, you look at some of the 80-year-olds out there, they're living fantastic lives. Why is it just okay to say, yeah, no, well, they were 80, they had a good run? That's not okay. It's not okay. It's just, it's cruel. And sometimes I read these comments and I think, you know, I don't wish anyone to get sick, but maybe just a little bit sick. And then they'll get better, but maybe they'll see that it's real. Like,
yeah, it's like some people have to experience, or a family member has to experience it. Until it gets personal, it means nothing.
Nothing. It means nothing to them. This is just an inconvenience for many, many people. It's an inconvenience that I have to stand in line to get into the store. It's an inconvenience that, you know, I can't go out for dinner with friends. it's
I can only imagine the conversations you must have around the water cooler or in the lunchroom, assuming you ever get lunch during your shift. But I mean, with your colleagues, I mean, everybody must be just livid all the time about this kind of an issue.
oh yeah, yeah, so much anger and disbelief, and just I guess I'm disappointed in, you know, people like, and people that I know. Some people, like, you read these Facebook comments and these posts, and you know, I've read that this is a scandemic, it's a plandemic, it's, you know, just it, yeah, frustrating.
Well,
Sure.
Carolyn, thank you very much for this. I mean, you've given us an insight into what's going on in the hospital, how nurses like you feel, and some of the challenges. Like and I have to say, I don't live in Alberta, but my adult children do. My granddaughter does. All my friends, energy media readers, everybody, many of them are in Alberta. And the problem here for me is that people are going to get sick and die from my network, but even still, people are going to have other health issues like a heart attack. You brought that up, and there won't be a room for them, or they'll be out in a rural area, and the rural doc will want to send them into Calgary or Edmonton, and the ICUs are full, and there's no room for them. And I know one of them, Dr. Noel Grisdale at Turner Valley, said, look, I mean, we're going to have to be at some point sending people home with an oxygen tank and a bottle of morphine pills, and hope that, you know, that's basically goodbye. You know,
Yeah.
we're sending you home to die. That kind of thing. If that doesn't make Albertans angry, I don't know what will. So anyway, on that happy note, Carolyn, thank you very much for this. Really appreciate it.
Thank you for having me.